everyone, it's Tiffany with Mommy Advice. I'm sorry I've been such a slacker. So let me catch you up. My little boy is almost 5 months old. He's super cute. Anyway, sort of what I went through, something that I can share now and hopefully help other people because it's something I've never been before. I needed mommy advice. Um, Postpartum depression. It was so crazy. I was just feeling really anxious, paranoid. I was convinced that somebody was sneaking into my house in the middle of the night and going to hurt my children, to the point where I was taping the door jambs with like blue masking tape, and then checking them every morning to see if somebody had broken in, like to see if the tape was broken. Yeah, crazy, crazy stuff. So, a friend of mine, I was kind of talking in a group to a bunch of girls, and she started describing her experiences with postpartum psychosis that she had when she had her daughter. Hi. Hi. And anyway, I could have been saying all the things that she was saying. So it got really scary. So I want to tell you, if you are feeling more anxious than usual, if you are feeling paranoid, if you are afraid for your safety or your children's, and there's no basis for it, there's no reason for you to be feeling that way, you're just having irrational thoughts with no basis, you should definitely talk to your OBGYN or your doctor and get some help. My doctor put me on, it's a generic for an anti-anxiety depression drug called Celexa. So I can't think of the generic, but they first put me on something called Lexapro, which turned out to be like, oopsie, we're spitting up. Nice, buddy. Turned out to be like $49 for 10 tablets, which was not doable, but I'm paying $24.99 for a month's supply, which is great. I want to tell you, when I went to the emergency room after I couldn't stand it anymore. I just didn't know what was wrong with me, and anyway, there was a baby. I don't even really remember this, but there was a baby. My friend was with me and told me, but there was a baby next door in the next room that was getting a swab up his nose, I guess for RSV swab, flu swab, or whatever. And the baby just was completely hysterically crying, and I just like lost it. Like, I couldn't stand to hear the baby cry. I wasn't having issues with feeling disconnected from my baby. I was actually fearing for my children's safety and lives, to the point where I couldn't think about anything else, and there was no reason for me to be afraid for them. So it was just crazy, crazy. In the middle of the night, I would like hear or think I was hearing babies cry, even though there was nobody crying. So mine was actually bordering on something called postpartum psychosis, which is kind of scary. But apparently they no longer use the term postpartum depression. They actually call it postpartum mood disorder, because they've found out that there are different aspects of the condition. Anxiety, paranoia, or you can just have depression. You can have feelings like I did of fearing for your children's lives, which has no basis or foundation for those fears or thoughts. You can feel totally disconnected from your baby. You can have like voices telling you to do things that, maybe not to your baby, or to yourself. You can think that your baby's possessed. I know that's so weird. I was just looking some of this stuff up. You can have thoughts thinking that your baby's like possessed by the devil because it won't stop crying. So here are my recommendations. Talk to your doctor. He did this awesome like questionnaire thing where it was like, I feel depressed most of the time, and then it was like a little bit, there was like 5 different choices, there was a neutral, and then like a lot. And I was like severely depressed, I guess, or whatever, so I've been doing really good. And don't feel ashamed to get on medication. I know a lot of moms don't because they're worried about nursing, but you know what? If it's your mental health and your ability to be a good mom versus being able to nurse your baby, there are amazing formulas out there now, you know, infant formulas. And I made the decision that I didn't want to breastfeed my son because I had a horrible experience with my daughter. Um, but it's completely up to you, obviously, and I totally support the choice to breastfeed or not. But just know that being a good mom is, and being there for your children and feeling like you're balanced and whole is much more important than giving your baby the breast, in my opinion. So don't be afraid to ask for help. Don't be afraid that they're going to take your kids away or something, because they're not. It's a very common thing that can happen, and it can happen anytime up to the first year. And if you don't get it treated, it can actually alter your personality for good. So I didn't realize it, but I think after my daughter, I even had a small case, maybe of postpartum. Nice, buddy. We just ate. Postpartum depression. Not so much depression, but just anxiety, because I'm feeling so much different after being on the medication. I actually feel like I did before I had kids, just calm and not worried about anything, and it's awesome. And they're treating it as an illness. They're treating it for 6 months because my doctor said that I came under the severely depressed. So they're treating it for 6 months, and then I will wean myself off the medication. And he said that I'll have a 2-week period where I will feel, kind of anxious and stuff, but then my brain will start making the chemicals on its own. So, which is good. This medication just gives my system a kickstart. So this is awesome. It's nothing to be ashamed of. You don't have to be scared. You should totally tell someone that you're feeling this way. I have a husband who's very supportive, but not necessarily. He has a hard time with medication and mental illness because he has experienced it in the past. Someone who was close to him who struggled with it and didn't get any help. But now that he's seen how much I've just completely done a turnaround and I'm feeling so much better, I think that he's a lot more positive about the whole situation, and he's very supportive, and we're doing awesome. So yeah, just tell someone. Don't keep it to yourself. If you're having thoughts of hurting yourself or frustration, anything like that, just tell someone. Just talk to anyone that you can. Tell your doctor. So yeah, we're doing great. This guy is 5 months old now, and he's 20 pounds. He's a big boy. And he's a really, really good baby. So anyway, thank you so much. I'm so sorry to those of you, like I said, that I haven't updated. But here I am, and I'm going to try to be more regular now. And I'm willing to take questions, anything that you might want to know. So thank you for watching, and have a great day. I wish you all healthy and happy pregnancies, and yeah, happiness in motherhood.